see about fibroid of uterus. Let's begin. Fibroid is the commonest benign tumor of the uterus and also the commonest benign solid tumor in female. Histologically, this tumor is composed of smooth muscle cell and fibrous connective tissue. So, named as uterine leiomyoma, myoma or fibroma. So the 3 points you carry forward is, it's a benign tumor, it's a solid tumor, and it's the most commonest benign solid tumor. Histologically, it is composed of smooth muscle cells and fibrous connective tissue. The third point is, it's also known as uterine leiomyoma, myoma, and fibromyoma. Coming to the incidence, it has been estimated that at least 20% of women at the age of 30 have got fibroid in their wombs. Fortunately, most of them remain asymptomatic. The incidence of symptomatic fibroid in hospital outpatient is about 3%. So you can see the symptomatic cases are only 3%, whereas the asymptomatic cases are 50%. They are more common in nulliparous women and those having one child infertility. The prevalence is highest between 35 to 45 years of age. So this is the most important part. Fibroids are most common in nulliparous women and in one child infertility and in the age group of 35 to 45 years. Coming to histogenesis. The etiology still remains unclear. The prevailing hypothesis is that it arises from neoplastic single smooth muscle cells of the myometrium. The stimulus for initial neoplastic transformation is not known. The following are implicated. In 40% of cases, there is a varying type of chromosomal abnormality, particularly in chromosome 6 or 7. Somatic mutation in myometrial cells may also be the cause for uncontrolled proliferation. So when the defect arises in the chromosome 6 or 7, either due to rearrangement or deletions, somatic mutation in the myometrial cells may also cause for uncontrolled cell proliferation. Role of peptide growth factors. Epidermal growth factor EGF, insulin-like growth factor IGF-1, transforming growth factor TGF. Epidermal growth factor, insulin-like growth factor, transforming growth factor stimulate the growth of leiomyoma either directly or via estrogen. Positive family history is often present. Growth. It is predominantly an estrogen-dependent tumor. Estrogen and progesterone is incriminated as the cause. Estrogen dependency is evidenced by growth potentiality limited during childbearing period, increased growth during pregnancy. They do not occur before menarche. The following menopause, there is cessation of growth and there is no new growth at all. So we'll see the image once. It seems to contain more estrogen receptors than the adjacent myometrium, frequent association of an ovulation. The growth potentiality is not squarely distributed among the fibroids, which are usually multiple. Some grow faster than others. On the whole, the rate of growth is slow. It takes about 3 to 5 years for the fibroid to grow sufficiently to be felt per abdomen. Risk factors